So, hello and welcome everybody. This is the first webinar in a series on consultation, uh, engagement and co-creation for the public sector. Now, in order to save my teeth, I'm going to shorten consultation, engagement and co-creation to CEC for the remainder of this webinar. I hope you'll forgive yet another three-letter abbreviation. But for those that don't already know me, I'm John Paul from Cannes. And I helped start CAM, which is a public sector campaigns agency. And over the past decade, we've been asked by many public sector organisations to help amplify their consultation and engagement activities, basically to make sure that they reach and engage the right people. By working with lots of different organisations on similar projects, it gives us a unique perspective. And this series of events is designed to help you keep abreast of advancements in communications, engagement, and consultation. We'll share brilliant examples of what's working well all over the UK. We'll bring in experts to advise and answer your questions. And we're really here to make it easy for you to design better engagement and communication activities in the future. So today we're zooming in on communications, engagement, or let's say CEC, in adult social care and health. A vast subject with vast opportunity for improving service delivery and outcomes for residents and patients. But we're going to be looking at the field of technology and how that might be able to help, and also a co-creation project, one of the best examples I've ever seen in Lambeth, called Project Smith. But it's probably worth looking at why we should focus on this area. Well, the challenges aren't going to get any smaller in the coming months and years. And many tough decisions are ahead. I mean, they're being made at the moment. Some have been made already. In terms of how we design services and design interventions to help people. Also, the people we're trying to help, their needs are becoming sometimes more complex and changing. And in order to service those needs and to help people, the data that we have, the resolution, when that data was collected, is less than what we'd like. The amount of engagement we have with communities in terms of shaping these services and helping people help themselves is not enough. The feedback loops that help us optimize and improve services are slow, talking years rather than weeks. And this means that the decisions that are made about service delivery aren't based on good information. That means that then the services that are designed maybe aren't always fit for purpose, and so don't have the patient or the resident at the heart of them. But that really all means then that the outcomes for the people in our care aren't as good as they could be. So we focus on this subject on CEC to help us improve that. And it's not an easy task. There's lots to think about. But some areas that give us a sense of positivity, I think, are around sharing and collaboration, which we're doing now, so good. There is so many things, so many wonderful projects that take place, but unfortunately are kind of hidden from view. And that's what this is all about, sharing these with each other. And in the public sector, it's one of our superpowers that we can share like nobody else. We also think that there's a lot of opportunity in technology in terms of being able to scale interventions and make interventions easy for people to access and use. And I think there's a lot also in empowering communities to help themselves. The power of connection, the power of empowerment seems to be the way to go. But we probably have to stop doing some of the things that we used to do and adopt new ways of thinking. So to first start to look at technology. Now, in my experience, technology can often be a source of disappointment and frustration, but occasionally it's absolutely amazing. And I was introduced by Pete Jackson from West Midlands ADAS to Darren from Bridgit Care. And he started to show me his what he's designed. And it's a way of supporting unpaid carers. And we worked together on some ARF collaborative projects recently. But rather than me try and describe it, I'd like to introduce it to Darren so that he can talk to us. So Darren, could you tell us a little bit about your background and how you started up Bridgit?
Yeah, so thanks, JP, and hi everyone. So yeah, I used to work in the tech space. I was a tech consultant, working globally actually in different organisations, looking at these big systems we were putting into hospitals, into GP surgeries. I actually tried to manage Frank Hester, who's been in the news over the last couple of weeks. So that was fun. I learned a lot from that process. But then about 5 years ago, I was actually a service director over in Manchester, looking after a team of nurses, and really saw this gap in terms of how we were engaging, not internally our own staff, our nurses, in terms of what we're doing, but actually how we're engaging and supporting family carers out there in the community, and also the charity sector and the voluntary sector, which was always a little bit distant from what we were doing in the NHS. So that's when really came up the idea, JP, that we'd launch Bridgit Care, and really focus down on how do we support that community, which hasn't been that well supported in the past. And JP, happy to share maybe a few slides and kind of explain that if it helps.
That would be brilliant. Thank you so much.
Let me just try and share screen. Yeah, I know there's probably a lot of us here, but if there are questions, I'm sure JP will be watching the chat and then firing them at me as we go. Yeah, so yeah, it won't take too long, but hopefully it might not go on the right screen. So I'm not going to jump into the actual full pack, sorry, just because it's not showing on my screen. But in terms of the challenge, so you guys are in this space, so you know that we've got big challenges in terms of the system right now. We're stretched, as we have been, to be honest, since I can remember. Some of the councils we work with, though, are in a difficult position, like organisations like Birmingham. They've been doing a great job, but they've got challenges in terms of how do we continue to provide the services that we need to our communities. So what we were doing, so I mentioned there that I had a team that I was looking after over in Manchester with nurses, but really saw this gap in terms of how we engaged charity sector communities in terms of what we do, and then looked at, can we do something differently? We know that when we look at that needs pyramid, we want to help people to stay at the bottom of that needs pyramid for longer, keep them out of high cost services. Nobody wants to be admitted to hospital. Everybody wants to be at home, but there are things we need to do in the parental space to make that happen. So we basically looked at 3 things. Can we identify people earlier on? So that's new ways to engage that community, be that through ads, be that through voluntary sector campaigns, be that with GPs. The second thing we looked at is, can we scale the support that we're providing to those communities through new types of channels and technology? And that's really what we do in the AI space. And then lastly, can we do that in a way that saves money to then reinvest into those real world services that can't be replaced by digital or enhanced by digital? And then what we did was build a portal. So this effectively allows us to push out ads, work with GPs, work with voluntary sectors, help carers come into a self-help portal where they get a set of AI coaches. So a dementia coach, a carer coach, somebody can advise you on technology-enabled care, as well as tools, things like discount cards for carers, ID cards for carers, what-if planning tools, and then support and then connection. So supporting people and then connecting them into real world services. And for us, really the key to a lot of this is working in close co-production with the charities that are out there, engaging and working with that community today. So the way that our systems work is we sit behind the brand of that charity partner in the region. The system looks like that charity to the carer, and we go together to those carer communities, engage and co-design the products that we build, the solutions, based on an understanding of the challenges that carers have got. And that's allowed us to make a really big impact. So right now we're live across the UK, quite a lot of council regions we're commissioned with now as well. But just in Birmingham, we were able to triple the amount of carers that we're supporting through the addition of a digital service. And that's, as a social enterprise, that's quite minimal cost as well. So a service across Birmingham might be 2 million for the real world service. We're an incremental extra 7k a month to provide the digital platform that can find, lots more carers, help them and guide them through self-help tools, and save them time. Importantly, their time stretched. They need to be able to spend time caring, but also looking after themselves and making a saving to the system. Because if we can help that community, they're already helping all of us to stay out of hospital, and that's the way we approached it. So we've really delivered something through Bridgit, which has been co-designed, co-produced with councils, with charities, with GPs, and with the users themselves. I'll just jump briefly onto here, but this is our site. So this kind of explains which locations we're live in. Here you can see some of the organisations that we've actually worked with. So we've got mainly charities that we work with in terms of key partners, but obviously commissioning through councils as well that have really supported the journey and allowed us to provide commission services on top of our free platform to carers. We're always reaching out, so we've got statements on our website as part of every project. We like to come and meet people. So last week I was in the campaign up in Scotland, camping on a beach, keeping costs down, but going to see a partner in North Ayrshire we've just launched with, to meet some of their carers, to speak to some of their teams, to make sure that what we're building is meeting those local requirements. And one of the cool things with AI tech is you can get super personalized and super local. So the way the technology works, it learns what that carer needs, where are they, what's the support that they need, what are those services for them, what are the events for them, and then it actually delivers the support that they require. And then the interesting thing, I guess, just to finish on, is that it's not for us just about that one demographic. We're a social enterprise that's looking to support lots of different people and communities. So we've taken that same platform, which finds people, supports them through AI, and then connects them into reward services. And we're now working really closely with ADAS in West Midlands to provide the platform across the patch for all international recruits, helping them join communities, helping them understand how to navigate and get jobs with all the AI coaches that we've been building with them. And then we're also working with some councils on a totally different use case, which is how do we support SMEs to get to net zero? How do we reduce our carbon footprint? And lots more conversations going on right now regarding supporting foster care, care providers, and just general small business development for social enterprises. So yeah, that's the quick summary, JP.
Thank you, Darren. No, it's brilliant. I hear AI mentioned almost everywhere and see so few good examples of it, or working examples. And sometimes directors say, what are we doing about AI? How can we do something like that? And there's really not a lot there. A lot of it is vaporware. So it's great that you've built this with care providers, with care receivers, and the ability to have conversations in WhatsApp or just on your phone, put together a care package I haven't seen anywhere else, and it's really impressive. Very good question from Graham. How do you support people who might see tech as a bit of a barrier to accessing the service?
So I think that if Graham, there's probably like 3 groups there. So there's one group which I would say is maybe 5% of carers, which I would say just this probably isn't the right tech for them. So if you're not comfortable using WhatsApp, then actually you need a real world service. You need someone you can chat to. So whenever we do any campaigns in the community, it's always there's digital platform here, or there's a phone number here with a local carer service you can speak to. So that's maybe 5%. And then you've probably got another 10%, which maybe are just about fine using WhatsApp. You're speaking to your family on it, using it a bit. And for that group, we provide actual content in the platform that can help with IT training, link into local digital hubs, stuff like that. And then I guess the other 85% are probably all right, using WhatsApp, using the tools. But we always start from that position that let's not assume everybody can use this, because not everybody can use digital.
Very good. It's absolutely spot on. And that's where the sort of technology and the quality on the ground interaction is so important. We can see that there's a lot of capable people who are unpaid carers but don't realise they're unpaid carers, and making sure they're supported with really easy user interaction or interfaces and user experiences is essential to kind of keep people away from the door in the coming years, and to enable better outcomes for the people they're caring for. And there are many examples, I think, of wonderful services, wonderful interventions that are done brilliantly at the person-to-person level, but then aren't scaled. And I think we should always think of technology as being a way of not the panacea, the be-all end-all, but a way of scaling interventions to many tens of thousands of people in a very, very cost-effective way. We work a lot of the time. Go on, Darren.
I'm just going to say one real example of that, and I can send these videos out and demos, but over Christmas, we were working with Microsoft to look at how can we take images from a person's home into WhatsApp, assess them, provide a risk assessment of those specific safety issues in the property, and then provide a structured risk falls assessment straight into WhatsApp. So that means that rather than waiting maybe 6 weeks for an OT to come out, you get a report in 3 minutes with some suggestions, some low-cost products from Amazon, some things you can do, and the details of all the local services that can maybe support you that are free in the voluntary sector. But then that's like a broader intervention, but then that then can triage and feed into the OT process. So what you say there in terms of we can do that then, it's 10,000 people in 3 minutes, that's great, but then it tallies into real world services and existing service models to find those people that need that extra help.
Amazing. And that can all be, the wonderful thing about tech as well and digital is that it is measurable. So in terms of creating reports on outcomes, that's almost automatic. You don't need to spend lots of time necessarily interviewing people. You can just see what was done. So in terms of making your lives easier and the impact of what you do more, there's so much opportunity there with technology. We at CAN specialise in taking these wonderful experiences, consultations, examples of product services, and putting them on the channels that people use. So that bit around connection in the digital sphere is where we can really help. But there is no replacement at all for co-creating and connecting with people on the ground. You can see that quote there, around communicating well by starting with mutual respect, and then using that to enable people to do their best by someone who is not connected to the Spice Girls at all. But I wanted to sort of now look at something which is one of the best examples I've ever seen of co-creation. I was down in Lambeth the other week. Oh, what have I done there? I was down in Lambeth the other week, and I was looking at or helping with a project called Project Smith, and it struck me as one of the most impactful examples of co-creation, which started with one idea and ended up delivering many, many more positive outcomes than initially intended. And Graham has been supporting that project, and he's kindly agreed to join us today to share it with us. So thank you for joining us today, Graham. Could you start by telling us a little bit about your career so far?
Thanks, JP. Yeah, so I left school and went to work in a long stay hospital as what we would now call a healthcare assistant, was put forward for social work training and ended up in child protection services, which was very different, and then began to think that I'd have more impact in a sort of population level. So moved to public health promotion, working around sexual health, HIV, more latterly training, and then I was offered the opportunity to be the director of a health promotion service that was that spanned Lambeth, Southwark and Lewisham, so a large part of South London. Subsequently to that, I've been working freelance, developing programmes such as Project Smith, and working closely with the Royal Society of Public Health, where last year I was honoured and humbled to receive their honorary fellowship. So that was a really great thing to happen. Thank you.
That's wonderful. And tell me, Project Smith, take me back to the beginning. What was commissioned and what was it intended to do?
Okay, so the original commission was to speak to the local council's manifesto for befriending, so to try and combat some social isolation. And the NHS target areas were to help people be better connected, to help people manage in a crisis. I think the fashionable term for that is evolve their resilience. I think we still call it coping in the real world, and to manage long-term conditions. And often people had more than one long-term condition, so they were frequently accessing services in the NHS. What was different about it was that this funding, I guess, came out of the Better Care Fund. It wasn't public health driven, as in the Public Health Directorate. And so they commissioned us to affect some sort of behaviour change that would allow people to demonstrate their well-being had improved.
And what did you do? How did you go about doing that?
Okay, so we looked at some of the more traditional methods, and they've all got a really strong place, and they've worked really well with sort of the sort of smoking cessation services and weight management classes and those sorts of things. And they do have a place, but they are quite directive, and there's a whole set of people that never access those. So we looked at providing a sort of cohort of training, which would combat social isolation in the first instance, because it's bringing people together, with a qualification. So the Royal Society of Public Health Qualification and Behaviour Change. So we offered that to everybody that attended. And we did a 4-day course where people identified on day 1 a small behaviour that they would like to change in the broadest sense of impacting upon their health and well-being, and recorded that and reviewed it at 4 weeks and at 6 months to see how people had done with that. But essentially what we did differently was we trained them in behaviour change techniques and knowledge.
And in doing that, what actually happened?
So almost universally, the goals they set on day 1 were met, and they were met within 3 weeks, which we would call a part achieved goal, but they continued to achieve those over 6 months. But what we found was happening was that they were reporting to us. We have something monthly called a safari. Sorry, I should have said that. And a safari is where people are invited from those cohorts to join, troubleshoot, think about what's not working for them, think about how they're connecting with other people and the experiences they're having in the community of good service and not such good service. And at those events, people were reporting massive shifts in their well-being. They'd made decisions to change quite difficult in sort of entrenched behaviours like smoking and managing weight and physical activity. And just to give you one example, I was working with a woman who, when she came to us, was really quite anxious. She was the carer for an adult son with quite severe enduring mental ill health. He'd had quite a few episodes in the previous 2 years of inpatient activity, and she was very stressed. She didn't feel connected to the community. She felt lonely and isolated. And 6 months into the programme, she was reporting not smoking as much. She was walking without her stick, wearing makeup, holding her head up high, and engaging with other people. The real outcome for that was that she encouraged her son to attend the training as well. And from a systems perspective, they report, and we can't put it all down to Project Smith, but they're happy to report there's been no inpatient activity for 4 years. So we think that's a massive measure.
And a massive saving as well. And with these projects, it's sort of training, and then it's leaving that sort of training in with those communities. In terms of ongoing sustenance for these kinds of things, other people are other organisations who are asking you to sort of deliver this in their locations. How are you designing it based on what you learned from Project Smith to be self-sustaining over time?
Okay, so Project Smith was year to year, hand to mouth for the first 5 years, and we had a external evaluation commissioned by the local authority, by the New Economics Foundation, who said it was cost effective in all areas and that it had added benefits and unexpected outcomes were being delivered that would benefit in other departments and directorates in the council and in the NHS. So I guess what we learned was that we needed to create a platform that allowed local residents to feel secure in their attendance and commitment to the project. So it was agreed that there would be a 5-year contract for RBE to deliver Project Smith as it is. What we've learned is that we wouldn't go to any other organisation that wasn't ready and that wanted to provide this programme on a year-to-year basis. 5 years has been massively effective in terms of encouraging people to commit to it, allowing them through the small grant scheme, which is also part of Project Smith, to provide real evidence base for their projects. So they're not having to develop a project, deliver it, evaluate it and report on it in a year. We can give them up to 2 years, and that's making a massive difference. And the very nature of the connection throughout Lambeth is that people are meeting partners that want to commit to their projects and their activities to sustain them. So it's like mutual objective meeting, really.
Amazing. Thank you so much for sharing that with us, Graham. If you want to talk about delivering something like Project Smith in your area, Tracy is the person to contact at RB Associates, yeah, I'm sure she'd be happy for you. But thank you so much for joining us, Graham. I know how busy you are. It's very much appreciated.
Cheers, Ben. Thank you.
All right. So yeah, we've sort of looked at some technology, and we've looked at some approaches, new approaches to empowering communities here. That's it for this first one. I hope you found it useful. We'll be sharing the recording with you so you can share with colleagues. Darren and Tracy and Graham from RB Associates, both brilliant organisations put together by people who have worked in care. There's no private equity involved. They are, social enterprises and, deliver a lot of value. So I can't recommend getting in touch with them enough. And if you want to talk to me or any of the people involved, these are the email addresses to contact us on. Our next webinar is going to be on April the 19th, and it's going to be focusing on winter demand. So if you'd like to join that, please drop me a line. Aside from that, thank you very much. I'm just going to quickly check on questions in the chat. No, we're fairly low on those. So thank you so much for giving us a bit of your lunch hour, a bit of your day. We hope to see you at the next event. Thank you so much.